Hey everybody, John here, obviously. Now, over Christmas and New Year's, I've had more days off than I am used to, which is to say, I've had days off. And being stuck at home, I wrote a couple of letters to politicians to keep myself entertained and vent my frustrations with them, of which there are quite a few. But I was looking up something online yesterday, and I noticed that one of the main news channels in Canada, called Global News, had on their website a request to the public for questions for the provincial health officer in British Columbia, the province that I live in, and the health minister, whose names respectively are Dr. Bonnie Henry, the health officer, and Mr Adrian Dix, the health minister, asking them questions about their ongoing measures of lockdown and system of apartheid that they're calling the vaccine passport system, or the vaccine mandate, which is everybody has to be injected and you have a digital passport, and if your passport says you can, then you get to keep your basic civil rights, which are guaranteed under the charter, and if you don't get to keep your basic civil rights. You're denied some of your rights, denied employment, denied access to certain types of business, and so on and so forth. I guess I'm letting the cat out of the bag of my feelings of the legitimacy of this program. It's not legal. It's just they've decided to impose these rules without even bothering to go through the pantomime of drafting a law to make it legal, which it wouldn't be even then, because the Charter of Rights and Freedoms, you can't pass laws that violate the basic charter of the country. Anyway, I have a couple of questions for them. They're asking the public for questions, so I sent an email asking my own. And I kind of think it probably won't get read on air or during a press conference, but probably somebody in the newsroom will have read it, and it might have got passed around, and I'm going to share it with you now. So hopefully you'll enjoy it. Hello, Mr. Dix. That's the health minister, and Dr. Henry, the provincial health officer. That's for the benefit of people outside of BC who don't know who these people are. I saw online that Global News was soliciting questions from the public for you two to address in an upcoming town hall January 10. I would like to thank you both in advance for taking the time. I hope you'll include an answer to this question in your responses. At the beginning of the pandemic over 2 years ago, it was announced both at the federal level in Ottawa and the provincial level, at least here in BC, that medical masks were not needed by members of the general public, and that only medical personnel needed to wear them when working among patients who potentially had compromised immune systems. Quite shortly after that, within a couple of weeks, that public advice was reversed. Everybody needs to be masked up while indoors, and the reason for this reversal was stated quite plainly. The supply of medical masks in Canada at the time was scarce and in short supply. So the public were misdirected as a way to preserve that supply for medical personnel, who arguably had a more urgent need of that scarce supply of masks than the public did. I don't have any doubt that medical personnel did in fact need those masks more than the public, and that preserving that limited supply for medical staff was in fact the correct policy, so well done there. However, the method used to preserve that limited supply of masks was to purposefully mislead the public about the need for wearing masks. This, of course, isn't the only public-facing misdirection from health officials in Canada, just one of the earliest and the most obvious, since it was immediately and officially admitted to at the time of its reversal. And that early admitted misdirection, of course, alerted many Canadians, including me, that health officials felt free to be as economical with the truth as they pleased as a method of directing public perception and controlling public behavior in response to the narrative provided by those same public health officials who were trusted. Some examples of this: the availability of long-established off-label medications which are both safe and effective in treating the novel coronavirus, or the fiction of overwhelmed hospitals revealed as fiction by hospital beds photographed with mannequins in them because there were hardly any actual patients to pose for those dramatic photographs. How about the efficacy of a paper, loose-fitting face filter in containing viral-loaded exhalations. Or, here's a good one, the deeply misleading practice of naming non-COVID deaths as caused by COVID in order to inflate the numbers. Or the claimed efficacy of an untested drug, which later proved so useless that there are now higher infection rates among the injected than among the uninjected. I won't say vaccinated, because technically it's not a vaccine. The list could be pages long. I won't belabor the point. You both know. My question is this. What, in your opinion, and within the bounds of our justice system, would be an appropriately grave penalty for health officials found to be purposefully misleading the public on matters of health, so that corruption or perversion of your offices for political gain or the pharma company profiteering was prevented from ever happening again? As you know, the price paid for these public misdirections includes thousands of deaths, the financial ruin of thousands of Canadian families, a very sharp uptick in mental illness, a sharp uptick in suicide and in homelessness, widespread social disillusion, national economic decline, the permanent developmental crippling of an entire generation of children, and a great deal of wider human suffering. The damage is ongoing, and it is escalating, even today. So what do you think, Dr. Bonnie Henry, Mr. Adrian Dix, could be, and within the bounds of our justice system, an adequately grave penalty to prevent such corruption in the future and prevent its attendant following damage? Thank you both for taking the time to answer this question, and thanks for everybody else listening to this question for their very kind attention, and I hope you all have a lovely, lovely day.